Look like we are live stream right now. Can you see the word light on the other side? Light, did it allow?
Yes, I can.
You see
Yep.
that? Yes. Here we go. Look like we are. Okay, so I'm going to close this window. All right. Welcome to back to my YouTube video channel. Good afternoon, good evening, and good morning all over the world. Here we go. We have, I'm excited and honored to have a privilege and honor to invite Dr. Andrew JM Willoughby on this podcast channel. We're going to talk about nanotechnology. We're going to talk about how we're going to apply it to research and development for your dental office, and we're going to talk about the implementation, how we do that. And of course, it's going to be, this is the talk that we're going to talk about on his class this Saturday. So Dr. Willoughby, thank you so much to be on this podcast with me tonight.
Locke, it's my pleasure. It's my pleasure to join you, and hopefully you and your viewing audience will find what we have to talk about in the next half hour or so intriguing enough that they want to learn more and sign up for some great CE this Saturday.
Absolutely. So before we go on, I just want to really quickly tell the story how I able to connect with Dr. Willoughby here. And one of my college friends were talking on the phone, and somehow he called my friend and we linked together. The conversation start 5 minutes and then we end up like an hour and a half. What I found out is Dr. Willoughby, his brain at the dentist, his brain is, I would say, maybe 20 times bigger than my brain. Okay, I honestly to tell you guys that. So he's incredible. He hold a ton of patent in dentistry, and he's inventor of many technology, and he's going to share with us. But I'm really honored to have somebody know somebody like you, Dr. Willoughby. It's just honor. So just please introduce my audience, you know, what you've been up to in dentistry, how long you've been practicing dentistry, and you are from Canada. Just give us a little bit of taste where your background are.
Sure, happy to, Locke. I'm 62 years of age. I've been practicing drilling, filling, and billing, doing dentistry now for 36 years. I practice in a little outlying area of the Greater Vancouver Regional District, outside of Vancouver, British Columbia, Canada, in a little town called White Rock, Langley. Okay, so I'm a general restorative surgical practice. I'm a solo practitioner. I have been all my life, and I run 2 practices, and I fly back and forth between my practice in White Rock and my practice in Prince George. I've been using nanotechnology now for, 17 years.
Wow.
And I was first introduced to it, Locke, by a group of people I met at a trade show. And they were promoting and selling and talking about this wonderful healing gel. So I took some samples with me from the trade show, and it was in the United States. I think it was in Atlanta, I believe. And I took them back, and, you know, like most things, they sit around in your office for a while until you figure out what you want to do with them. And you go, oh, I guess I should try these products. So I started trying them, and lo and behold, boy, did I begin to realize that they had profound antimicrobial benefit, but they also had wound healing and the ability to reduce smear layer and biofilm. So advance, to 2018,
wow,
where I had been using these products, but I was introduced in 2018 to a PhD who is in his world is tax R&D, and he's a regulatory consultant, and he helps companies bring products through medical device approval in Canada, United States, and bring products to market. Mm-hmm. And we're talking about how I've been using these products to improve patient outcomes. And he goes, gosh, have you ever heard of tax R&D? And I said, no, actually, I haven't. So he explained to me that if you are within the health sciences field and you have something that is novel in terms of product, process, or protocol, that if you are able to address the technological uncertainties in your industry, and in dentistry, there's a number of them, I'll go into that in a bit, that you have the ability to file as part of a corporate tax return and receive tax credits back from your governments for performing equivocal research and development. Trying to improve patient outcomes is absolutely eligible for this type of a program. So I started doing it. And out of those efforts came this profit taker program that I've created. Mm-hmm. And I've had a lot of input. We have now almost 200 dentists using it in Canada, United States. They purchase product from our company. Mm-hmm. We then show them how to use specific clinical protocols to address the 10 most common technological uncertainties in dentistry. And I'm going to rattle those off quickly. Pain, inflammation, infection, disinfection, wound healing, smear layer, biofilm, antibiotic resistance, aerosol generating procedures, and chemotoxic ingredients. Those 10 things basically define everything we do in dentistry. And yet, in dentistry today, there isn't one technology platform out there that makes for a good antimicrobial agent, let alone a targeted antimicrobial agent, right? And that is also wound healing. If you were to ask your viewing audience, amongst the dentists that are listening to us, if they could give us the name of just one product that is a targeted antimicrobial and wound healing product, I'm all ears, because there aren't any. Because typically, products that are antimicrobial, like chlorhexidine and benzalkonium chloride and BHT and all of those nasty chemicals that are antimicrobial antiseptics, they're lousy wound healing agents. For Pete's sake, Gluma. We're all familiar with Gluma and what it's used for. But right in the product information sheet, it says, don't ever put it on the gum because it will cause the gum to ulcerate. It is cytotoxic to gingival tissue. Do you know what the G in glutaraldehyde or the G in Gluma stands for? It's glutaraldehyde. That's a very nasty chemical. So we have developed a nanotechnology platform that addresses all of the technological uncertainties in our industry. It improves patient outcomes, but because it's so novel and so unique and can do things that other products cannot do, we're also able to file broadly and robustly for tax R&D activities. And you go through this corporate tax R&D form when you're filing your corporate taxes, and you get tax credits and money back from your tax department. So we're all about improving patient outcomes, but we are businessmen, and we have to be profitable so that we can maintain our business and continue offering the services that we provide. So we can't do it deficit financing, right? It's very difficult to do. So for us to be more profitable means trying to find ways of reducing our operating overheads. And so this is what this program is all about. It identifies all of the chemotoxic ingredients that we're using. We have a world-renowned biological dentist out of New York State, his name is Dr. Jerry Curatola, and he lectures to thousands and thousands of dentists each and every year. And Jerry's going to talk about his concern about just how many chemotoxic and cytotoxic ingredients are being used in the dental industry currently. And we have alternative procedures and protocols for those chemotoxics. We've got a Dr. Leo Moline, who is a world-class implant surgeon. And Leo's going to talk, he's been using the product for the last 7 years. Wow. He runs CE programs in the Dominican Republic. And there's nothing surgical that he does. And he is an implant-only practice in La Crosse, Wisconsin. Leo doesn't do surgery without these nano products and protocols. And he, yes, is in the midst of filing for tax R&D. So you get the benefit of helping the patients and the benefit of improving your fiscal health of your dental business. And that's what the Profit Taker program is about. It shouldn't be an embarrassment to be making more profit. We're in business to make a profit. It's just really hard these days with operating overheads being as high and our costs being as considerable as they are.
Beautiful. Just to have a quick question or a curious question, when you mentioned about the nanotechnology that you are implementing, are you talking about multiple different chemical that you use in or ingredient that you use in, not just one, right? This is like serial different product that we're talking about, Doctor.
So you are 100%. You hit the nail on the head. It is a platform, and this nanotechnology comes in various formats. And I have developed protocols over time because there is no panacea. There's no one product's going to solve all the problems. So what we do is we take our gels and our creams and our serums and our liquids in various concentrations, and we combine them with other ingredients. So I combine our hydrogel. This is our hydrogel product. And when we are using it for crown bridge and hemostasis, I'll make a point of how we use it. We combine our gel with aluminum chloride. And that addresses the technological uncertainties that are presented by using a product like Viscostat. I think we're all familiar with Ultradent's Viscostat product.
Yes.
So why are we using Viscostat? To stop bleeding. But has anybody stopped to think what is causing the bleeding? The bleeding is coming either from biofilm and bacteria, infection, or it's coming from trauma from aggressive retraction using cords, or with the burr, maybe a little too far sub G, running through carelessly through the interdental caul. And so you've got trauma on one hand, and you've got bacterial biofilm on the other. The Ultradent product is aluminum chloride in an innocuous gel carrier. It is neither antimicrobial nor wound healing, smear layer, or biofilm reducing. It's just a hemostatic. So by introducing a wound healing hydrogel that is antimicrobial, that can reduce smear layers, combining that gel, that nanotechnology with aluminum chloride, I'm addressing a technological uncertainty. And that qualifies for R&D activity. So we show in this program, we show dentists how to combine the base products with ingredients like aluminum chloride, hydrogen peroxide, EDTA, et cetera, et cetera. There's a myriad of other ingredients that you can custom formulate our technology with to get improved clinical outcomes.
Okay, so Dr. Willoughby, people might ask, like, you keep repeating the same procedure and you are studying different patients, right? And then you going back and how do we develop that type of protocol to consider us that research development, like this is a product from your product, not my product, for example. So like my question, like, okay, yeah.
I think I understand your question. Let me answer it this way.
Yeah.
So we sell baseline products, base ingredients. The answer for performing a root canal treatment, we all know what we do. We take sodium hypochlorite, we're taught in dental school, and we combine it with water. Potable water, distilled water, and it's usually the dentist telling the CDA how to dilute it down, and ask 10 different dentists, and they'll tell her, well, I sometimes combine it with CHG. I sometimes combine it with hydrogen peroxide, and I sometimes put a little bit of EDTA in there. Everybody is blending it and using it differently.
Yeah.
That's what we encourage you to do with these products, because no two patients are the same. No two patients have the same oral microbiome or gut microbiome. No two dentists are going to always be using the same bone allograft material, the same collagen membrane, the same sutures.
Right.
The patients are all different. They have different age, different sex, different comorbidity factors, different genomic profiles, and different bacteria in their mouths. So when you look at when you add all of those things together, you get just millions and millions upon millions of different permutations and combinations of products and ingredients.
Yes.
And that's really where the ability to unmask, uncover, discover, and do equivocal research and development stems from. No two patients, you're not going to get the same outcome with the same two patients. There is just for bone grafting alone, Locke, combinations and permutations amongst the general population of dental patients runs into the billions. Think about it. How many different types, let me ask you this, how many different types of bone allograft material are out there? 100? 150?
So many.
And what about collagen membrane?
So many.
And what about suture material?
The tongue.
Okay. And so my point is, you add all of those factors and different product combinations together with different dosages, different dilutions, and different other ingredients, incipients, and adjuvants that you combine with these base ingredients, and you get a whole bunch of variables.
Right.
And that is the essence of research and development. So this is not something that one dentist, just because I'm selling a product, one dentist can do. It is something that any dentist can do. Remember, the practice that you perform in general practice, we're both general practitioners, but do you think we do the same exact procedures day in and day out? No, of course we don't. Do you use the same materials? Of course we don't. We're all different. So is a very complex layer cake that goes into researching and developing, unmasking and discovering what and how to improve patient outcomes with new products. And so that's what we do. We just have a platform that allows you to very robustly and ubiquitously apply this into every aspect of the practice, from hygiene, restorative, endo, perio, surgery, sleep apnea. For Pete's sake, I even have amended Botox protocols where I use a little nano silver facial serum. Okay. And I combine that with red light therapy and Botox to extend the efficacy and performance of the botulinum neurotoxin. And so that's part of just one of hundreds of clinical protocols that we teach dentists how to use.
So, Dr. Willoughby, this for the one of the reasons why I invite you here tonight is because the class that you're going to be lecturing with, among other speaker, would be happening this Saturday in Vegas. Can you give us a little bit of taste? Where is this going to be, and how do we register? I have some information right here. Is this where they can click on here and register right here?
No, go up to the top of that document.
Mm-hmm.
Right up to the very top on that QR code. If you go to the Verisol website, and there's a dental CE tab,
mm-hmm.
and you can find those. Yes, that one page document right there on the top right.
Mm-hmm.
That one has a QR code on it. The 2-pager down below it, straight down below. Yes, that also has a QR code. And you can click on that, and that will take you directly to the CE provider. That is Cornerstone Aesthetics. They're offering, it's a full day of CE with some experienced dentists and some tax consultants. This fellow here that you just brought up, that is the largest dental broker in all of Canada. Okay. And you watch that, and he will tell you that he has never seen a program that can increase the profitability of a dental practice like this one. So that's an interesting little 7 or 8 minutes.
Yeah.
These gentlemen that are pictured right there on that screen, there's a two tax R&D guys, and then there's Malene, Willoughby, Moudreau, and Curatola that are practicing clinical dentists. And we're going to talk about, in our own perspective, what it's like to use these nanosilver products to help improve patient outcomes. This whole course takes place this Saturday in the offices of Dr. Byron Blasco out in Summerlin. And he's a very notable, well-liked general dentist. He's tons of experience, and he is the dentist of record for the WNBA, Women's National Basketball Association, as well as the Golden Knights, pardon me, and the Las Vegas Raiders football team. So he's very high profile, and it's in his magnificent clinical over-the-shoulder mentoring lounge where we're going to be giving these lectures.
Wow. I wish I can be there. I'm hoping to be there, but how often do you give these lecture, Doc?
Locke, this is the official launch of this program.
Mm-hmm.
We've been asked to do this by a number of smaller DSOs so that we could broadcast it to people. I've been doing these via Zoom meetings, and they just wanted a bigger, more robust medium in which to kind of broadcast this to a larger audience. So this is actually the first one where I've done it with other dentists that have been using the nanotech, experiencing the results with their patients, and that are actively involved in the tax R&D. But you do not have to physically be at the lecture in Las Vegas, although, it's always fun to go to Vegas, right?
Yeah.
I was just down there 2 weeks ago participating in the Invisalign GP Summit at the Bellagio Hotel before it got hacked, and they ran into those problems on Sunday morning, and apparently they're still having those problems. But you can register online, and you don't even have to watch it via webinar. At the end of the day, if you've registered beforehand and paid for the course, you will get an email sent out to you, which is a link to the recorded webinar, and you can watch it as many times as you want at your leisure. You certainly do not have to, shuffle your last minute plans, as this is very last minute, and rush to Vegas. You can watch it in the comfort and peace of your office or of your own home, and you can do so when you have time.
So basically, it's A unit, C class. Either it can be live at the office in Vegas, or you can watch it again. If you miss it, they can send directly an email. When you register, they send you an email at the end of the whole day lecture, and you can watch the video over and over again. And
yes, and you can also watch it live webinar, so live streaming.
Yes,
but if you miss parts of it, you're at the end, you're going to receive an email anyway, which is a link to the webinar, and you're able to watch it again.
Okay, beautiful. Thank you so much for your time, Dr. Willoughby. I really appreciate your time, and it's an honor again to have you on the podcast. I'm looking forward to continue invite you in the furthermore at the time allow for us to get together again. Can't wait for some of my friends will register and we talk, and hopefully we can connect, and you can answer a lot of questions that they have in the back of their mind.
Yeah, Locke, thank you so much for this opportunity just to talk. We have a mutual friend, and Charles, appreciate Charles hooking us up, and I hope to get some product into your hands so you can start helping your patients see the benefit of these products. Because this is what we're in dentistry to do, is to help our patients. And I'm just getting a little sick and tired of being told by manufacturers that I have to use CHG and these new bioactive polymers where they're putting antimicrobials into bonding agents and dentin priming solutions and resin cements is a really scary thing when you think about some of the cytotoxic and chemotoxic products that they're using. I just think it's inexcusable. And I think more dentists need to start really critically evaluating what products we are using and implementing on our patients.
Mm-hmm.
There you go. Thank you for your time.
Really appreciate it. For the story, for the listener who really want to get to know more of your product, they have to go to the class. And of course, there is a closed mentorship and fellowship program that help them grow. So this is just a little taste of, I'm hoping that you guys enjoy us for the this Saturday event in Vegas. I put again in this slide right here one more time so everybody can use the QR code here. Dr. Willoughby, have a great good night, sir.
Thank you, Locke. I appreciate your time.
Take
Be
care,
safe.
sir. Yes, have a good night.